And welcome to the Windsor-Essex County Health Unit's media briefing for Wednesday, September the 14th. We are joined by our CEO, Nicole Dupuis, as well as our acting MOH, Dr. Shankar Nessathuri. We have our media on board. We are ready to start with opening questions. We will start with a round of just 2 questions from each outlet, please. We will open with questions from AM 800.
Good morning, Nicole. I believe this question's for you. Just in regards to the new vaccine rollout, can you talk about the health unit's plan?
Sure, I'll start, and then Dr. Nessathuri may want to add. But our plan is not that different than it has been in the past. So we are working with our partners. We'll be using mobile clinic as well as, everyone knows, we also have our clinic here at our health unit site at 1005 Olette, as well as our site in Leamington at 33 Princess. We'll, of course, continue to work with local healthcare providers to dispense vaccine to them for their own patients as well. We'll make use of pharmacies in our vaccination plans. For the bivalent vaccine, it will be, a similar start to how we've rolled out other vaccine releases in the past. So we'll be starting with the highest priority groups as per the ministry guidelines. So that, of course, is individuals living in long-term care, retirement homes, those who are immunocompromised, and all that information, of course, will be able to be found on our website. And individuals will be able to go to our website or call us to book appointments as well.
And then later this month, I believe it's opened for other individuals, other categories to sign up. Do you think we'll have enough vaccine for
Windsor-Essex community schools? Here, we prepare our students for college and careers through awareness, exploration, and preparation.
No.
I apologize for that. That was me.
Sorry, I didn't get the last part of your question.
No problem, Nicole. I'm just wondering about the amount of vaccine. Obviously, it opens up to more of the community later this month. Do you think we will have enough vaccine in Windsor-Essex when that, I believe it's the 26th, when that is eligible?
Oh, maybe I can answer that. I mean, we do, and I'll turn over to Dr. Nessathuri. And we do feel confident that we will have enough vaccine for the individuals that are interested in receiving their booster, the bivalent booster, as we roll it out. So, yeah, we do feel that we'll continue to get our vaccine, and as we roll it out, we'll have enough for those who are eligible and interested. But I'll turn it over to Dr. Nessathuri to see if he would like to add anything.
So thanks, Nicole. I guess my first point would be that, like historically, we've had a multimodal distribution channel of vaccines, and that includes the Public Health Service sponsored clinics, but also pharmacies, physicians' offices, and clinics themselves. We anticipate those same distribution channels will be used for the bivalent vaccine. We receive supplies of vaccine from the ministry on a regular basis, and as we have vaccine, we will continue to distribute it. I anticipate that we'll have enough vaccine to meet the demand, and over these next few weeks, we'll be able to schedule people throughout the community for those people who'd like the vaccine to get it. I guess the core public health message is that I think the latest estimate is there are 200 and something thousand people who are not up to date or who are currently eligible for vaccine but not up to date. And we can have our epidemiologists share that exact number. So as we approach the flu season and the respiratory disease season, which is coming close, which is upcoming, it's really important for people to get up to date on their COVID vaccination program, as well as be up to date on their flu vaccination.
Thank you.
I'll just add for the exact number as of today, when we looked, it's 252,775 people within Windsor-Essex that are 18 and over and would be considered eligible for the bivalent.
Thank you.
Thank you all. We'll go to questions from Blackburn. Oh, we will try coming back to Blackbourn. Moving to questions from CBC.
Hi there. So you mentioned that there were 252,000 people that are eligible for the bivalent vaccine. How many shots has Windsor-Essex acquired from the province, and what's the sort of I don't want to say time frame, but when? Yeah. So how many shots do you have currently, and how many are you expected to, like, when are you sort of expected to get them if you haven't got them already?
So I don't have the exact number. Again, similar to in the past, we receive a regular supply of vaccine week by week. If your question is, do we have enough vaccine to vaccinate 252,000 people tomorrow? No. But we also wouldn't have the capacity or the manpower to vaccinate, everyone tomorrow. So, we do have enough vaccine to fill our appointments and our strategy as it identified and laid out by the province, which again will be starting with those most vulnerable long-term care retirement home, and so we'll continue through this strategy and add more appointments every week. And again, we believe that they'll definitely have enough appointments and availability within our community for those that are eligible and interested, as for the next month and coming.
Okay, and I just want
to add to that, if I could, we anticipate, based on what we know right now, that everyone who wants to be vaccinated will be able to get scheduled appointment and get the vaccine, and that's the construct we're currently working with. Sometimes the rate limiting step is the actual physical availability of vaccine. Sometimes it's just the number of clinicians that are available to inject people. So I think that as we move through these next few weeks, that we should be able to offer vaccine to everyone who would like the vaccine, and we would really encourage people to get vaccinated and come up to date.
Thanks, Doctor. And I was just wondering if you wanted to provide a comment. I mean, we reported on a City of Windsor firefighter who lost her job because of the city's COVID vaccination policy, and and she's one of 20 former municipal workers who are suing the city as a result of losing their employment due to the city's vaccination policy. I was just wondering if you wanted to sort of provide a comment on that right now. I understand it's an ongoing case and that might be difficult, but if you could provide a comment on that battle, if you're aware of any details that you could provide.
Yeah, well, no, thanks for the question. This is a question I think that's best addressed by the City of Windsor as it relates to an employee of the city. But I can share with you that vaccination is important, and it's particularly important to keep vital services functioning in the community. That includes hospitals, firefighting, police services, ambulance. And I would encourage people who work in those particularly critical infrastructure, social infrastructure roles to get vaccinated and get up to date. What we want to do is to maintain capacity to care for people in our community. And I think that's an important public health goal. And it fits with everything else that we've been articulating, which is to try to get the population or the community up to date on their vaccines.
Thank you very much. We'll move to questions from the Windsor Star.
Just to clear up some issues for the general public. For those who did receive a third or fourth dose of the COVID-19 vaccine, what is their eligibility concerning the new bivalent vaccine? Is there an interval that they have to wait before they can receive it?
Nicole, perhaps you could answer that, and then if there's anything I can supplement if necessary.
Yeah, so to be eligible for the bivalent vaccination, it is a booster. So you just need to have had a primary series, and then any individual who is interested, whether they've had their third dose, fourth dose, or have just received their second dose, the recommendation currently from the ministry is 6 months post their last dose. So if you've had a fourth dose, the recommended time interval would be to wait 6 months. Following that, if they're dosed 6 months following that, second dose 6 months following. So that's the current recommendation time interval to receive the bivalent.
Yeah, if I could just supplement, the vaccine schedule has certain nuances depending on the circumstances of any individual patient. And I would ask people that have questions about their eligibility to look on the Public Health Service website, and that'll give them more granular information about their eligibility time and dates.
Are there any thoughts that you can share for people who may feel trepidation or hesitation about receiving the bivalent vaccine? Is there any word on potential side effects?
Well, every medical treatment has to consider the balancing the risk versus the benefits. But I think that the benefits of being vaccinated far outweigh the risks. So I would say that that when we look at the risk-benefit relationship, that is to your benefit to get vaccinated. The other thing I'd share is when one gets vaccinated, not only are they helping themselves, this is true of many vaccines, not only are they helping themselves, they're also helping other people in the community. And with an infectious disease, as we lower the number of people infected in the community, that also helps people who perhaps cannot get vaccinated because of their medical conditions or can't be effectively vaccinated because of their underlying medical conditions. So when one gets vaccinated, they're doing something beyond just helping themselves, they're also helping others.
Understood. I'm just curious in terms of the original series, you know how people had reactions such as flu-like symptoms for 24 to 48-hour periods and so forth. Is that something comparable with the bivalent vaccine?
Yeah, some people may have some transient side effects with the bivalent vaccine. And, if you send your question in a granular way to us, we'll respond in writing so we can give you a more fulsome response. And we can do that today. If you send us an email, we'll respond today.
Okay, thank you.
Thank you. Any questions from Blackburn?
Yes, sorry, I'm all thumbs today. I just wanted to ask what the uptake for appointments so far has been for the bivalent shot, because I know that that opened up this week.
So
Nicole, perhaps you could.
Yeah, if you're looking for like appointment-based uptake, we don't have that information yet. Again, our initial start is to focus on those prioritized groups. I think the response is going well as far as rolling out to those prioritized groups, including, again, long-term care, retirement home, those who are immunocompromised. So really, we're working with some of our partners and various agencies and institutions in that capacity right now. But probably next week, we'd be able to, over the next few weeks, be able to give you a better idea of what the broader response.
Okay, thank you. And I guess I also wanted to ask if there's been any update on the safe injection site downtown and getting it prepared for opening.
No, it feels it takes a very long time. So just an update again. I feel like I've given this update before, but we are, continuing to work through the process. There are, updates that need to happen, with the facility itself to bring it to a standard to be able to open the doors. So we've been working very hard behind the scenes to get everything ready, including, permits for construction to just modify the inside examples of changing the doorways and looking at bathrooms to make sure they're accessible, et cetera. So there's lots of work that needs to go into the building itself. And we, are continuing to move forward on that. And, at this point, that's probably the only update that I can give, but we continue to make progress and continue to work towards, hopefully an opening date and then, near future.
Thank you.
We will move to our round of follow-up questions with one question per media outlet. We will start again with AM 800.
Nicole, just looking for another update here, just in regards to the secondary students. How are those numbers looking for their submitting their immunization records?
So as of the end of the day yesterday, or as of this morning, we still have 1,519 secondary students who are outstanding. But I think we've made incredible progress considering, when we started in June, at least, when we sent out notices, there were over 13,000. So we are at this stage at 1,519. And again, our health unit staff have been working around the clock and are here on site available. And we have clinics to help individuals enter the records, or if they're really needing those vaccinations, ensure that they get them. So as well, we also have had weekend clinics to make sure we're available. So that's where we're sitting right now. But it's been come a very long way considering where we started. And Dr. Nasseri may want to add.
Sure. So I guess the first thing that I would share is the vaccine verification processes, which is what we're doing right now, I think has yielded some important results. There are approximately 19,000 young people in high school in the health district, and we would estimate that all but 1,500 have become up to date on their required vaccines or vaccines covered by the statute. I think it's also important to recognize that we expect more people to get vaccinated, and this effort has brought more and more people up to date. Vaccination helps young people throughout their lifetime, and it's particularly important as young people leave high school and graduate that we can provide them the best possible health moving forward. And so in that way, I think we should be looking at this as a positive to the extent that 19,000 young people were eligible, and at the current time, 1,500 have not yet become up to date. The second is the health unit, community partners, physicians, clinics have all worked together to try to provide access to vaccine so there's as little disruption as possible to young people. And I'm hopeful as the days progress that we'll continue to vaccinate more young people. And for those people who just require their documents to be up to date, that we'll also be able to enter them in the computer systems.
Thanks, Dr. Ashley. Sorry, one quick follow-up to that comment. Has suspension notices been issued? I believe when the first release came out, September 14th was the date for suspensions. Was that extended, pushed back, or did they start today?
No, suspension started today.
So those individuals are all suspended as of today?
So there would be at this point, 1,000, a little over 1,500 students who would have received a suspension.
Yeah, and if I could share some
you.
additional context, individuals and families were advised of the vaccine verification process on numerous occasions and have had numerous opportunities to come up to date. So the health unit recognizes that this is potentially disruptive to young people and families, but also I think should be recognized. There have been numerous communications with people to come up to date well before suspension date. And I'm hopeful that young people and families will avail themselves to the opportunities to get vaccinated in these next few days as well.
Thank you. Sorry for the additional questions there.
Perfect. Thank you very much. We'll move on to a follow-up question from CBC.
It's more really of a sort of just a curiosity thing, really. These media sessions, they were usually held on Thursdays. Why the shift now to Wednesdays? Was there like a backroom sort of issue with that, or was it just, you figured what the hell, we'll just move it a day?
It was availability. So it just needed for us to be moved to Wednesday so that we could be available to continue. It's just a scheduling conflict.
Okay, thank you. We'll move on to a follow-up question from the Windsor Star.
I'm sorry if this is repetitive. Just to clarify, the deadline for the the deadline for bringing secondary school students' immunization records up to date was September 12th. So as of today, how many students are suspended?
So there was a little over 1,500. There's a little over 1,500 that are still outstanding. Now, we do know, yesterday we would have received, probably additional individuals may have gotten their vaccination. And again, that number will continue to go down. So each day as we enter records and see individuals that were among those that would have received a notice as of that deadline of the 12th.
Do we have an exact number?
It's 1,519.
Thank you.
Thank you. And a follow-up question from Blackburn.
Yes, just a quick one. I just wanted to ask if that a little over 1,500 is comparable to past years, pandemic not included.
So it's difficult for us to compare. Previously, I know we've reported that we were working on a plan related to the Immunization of School Pupils Act and making sure that we were bringing everyone up to date. So it's difficult to compare to previous years, but we have had a high number, in our past as well. I think it's just best to look at where we started. So as Dr. Nassaturi reported, there's a little over 19,000 children in secondary school. We knew, given the pandemic and, for other reasons, that there would be a number of individuals that were, out of date. We started with notices around 13,000 notices. So those were the numbers that we had that were not up to date, according to our records. And, as of now, September 14th, we're at 1,500. So I think, we've definitely, community should be congratulated. And our team as well. We've definitely come a long way, and we're very pleased that we have better protection among youth and that individuals are able to access and get those preventative vaccinations that they need.
Absolutely. Thank you.
All right. Thank you, everybody, for joining us today. That concludes our media session. Our next scheduled session will be on Wednesday, September the 21st. Thank you very much. Have a wonderful day.